So you've been told by your doctor that your thyroid is fine, it's normal, it's perfect, all the labs look great, but still you're struggling with the classic thyroid symptoms. I mean, you're feeling sluggish, foggy thinking, you're gaining weight, your menstrual cycles are off, you're feeling cold. I'm making this video to go over the 3 things that most doctors miss. And by the end of this video, you're going to have a better understanding of 3 actionable steps that you can take to begin to start feeling great again. So by the end of this video, you're going to understand 3 things. The first is going to be how to best measure thyroid hormone. The next thing we're going to do is take a look at the hidden autoimmunity that could be potentially affecting so many of you. And the last thing that we are going to do is to review how stress and thyroid are intimately connected. And if you're not addressing your stress response, you're missing an opportunity to optimize your thyroid health. So to begin with, I want to talk about thyroid testing. So many of you have been to your doctor, you've presented with the classic thyroid symptoms, and your doctor says that we've checked a TSH and this is fine. Now, I am here to tell you that measuring a TSH is not going to cut it. That's not going to give you adequate information about what's going on in your thyroid and hypothalamic and pituitary axis. The reason is because all that TSH is measuring, and remember this stands for thyroid stimulating hormone, is the amount of this hormone that is being delivered from your brain to the thyroid gland. But it's not giving you any information about what is being delivered in terms of thyroid hormone to the cells, which is where the rubber meets the road. Now, I've been working with patients to optimize their thyroid health for about 25 years, and this has given me the opportunity to see how much is missed when a conventionally trained doctor just checks the TSH. What I've seen is how patients look when they've come to my office with presumably normal TSHs from their doctor's office. I've seen what happens when we do a more advanced thyroid study, and then I see how they look once we've taken the steps to intervene and optimize their thyroid health. So before I get any further, let me just remind you guys that to really understand what is going on with your thyroid gland, you need to measure 4 things. And those are a TSH, of course. This is an inexpensive, simple test, and it's a pretty good guideline. But to really know what's going on with your thyroid gland, you also need to measure a free T4 and a free T3 and what's known as a TPO, and we will get to that in the second part of this video. Now, for a number of people, you might benefit by also measuring something known as a reverse T3. Now, reverse T3 is kind of like the opposite of T3. And as you guys know, T3 is the active thyroid hormone that goes to the nucleus of your cells and tells your cells to increase their metabolism. Reverse T3 is kind of like its evil twin brother that basically blocks the action of T3 at the receptor sites. So those are the essential hormones that need to be measured. TSH, free T3, free T4, and TPO, which is a measure of autoimmunity. And in some cases, you might consider measuring a reverse T3. And I recommend doing this if you are on high levels of T4, which is also known as Thyroid, or you seem to have normal thyroid hormones, but yet you're still having significant hypothyroid symptoms. Now, the next thing I want to talk about is autoimmunity and thyroid health. And is it possible that 1 in 6 people watching this video could have antibodies to their thyroid gland? This means that 1 in 6 of you have an undiagnosed autoimmune condition, and this is contributing to your low thyroid state. Now, the autoimmune condition I'm referring to is known as Hashimoto's thyroiditis. And what this is a condition in which antibodies are made to your thyroid gland. Now, in classic Hashimoto's, there is initially a hyperthyroid and unexpected hyperthyroid state that happens when these antibodies first begin to stimulate and burn out the thyroid gland. But the classic presentation of Hashimoto's is with a hypothyroid state. The important thing to remember is that so many people are struggling with the development of these anti-thyroid antibodies without even knowing it. And this progression is slow and it's indolent, and it is causing so many of you to lose precious years of your life and the opportunity to find out what is going on. So this is why I recommend that if you are doing a full thyroid study, that you also include the TPO and TG antibodies, because this is going to give you a full picture into your possibility of having an autoimmune condition. Remember, 1 in 6 people in the United States have documented antibodies against their thyroid gland, which means that there might be a far greater percentage of you that are walking around who haven't had these measurements made and are slowly working on an autoimmune condition. Now, the last thing I want to talk about is this association between stress and thyroid hormone. Because as so many people in the United States and the developed world, we're struggling with an inordinate amount of stress. And what happens is that stress directly impedes on the way that our body makes thyroid hormone. Now, if you take a step back and remember that the human animal is operating on these ancestral genetics. I mean, we're operating on genetics that have kept us alive for the last 400,000 years. And for the majority of that time on this planet, we have not had the luxuries of plenty of food and plenty of water and plenty of opportunities to eat. So our entire physiology is predicated on maintaining enough glucose in our bloodstream to modifying our metabolism so that we use every last bit of energy to keep our heart and our brain alive and ultimately to pass on our genetics to the next generation. So as we increase our stress response, we increase our adrenal output of cortisol and adrenaline, we get into a relatively hypothyroid state. And it makes perfect sense. I mean, if you're in nature and you're starving and you're having to break down the tissues in your body, break down your bones and your muscles and your fat supply to liberate glucose to keep your brain alive, that if we had an opportunity to tamp down our metabolism, those calories that we had previously stacked onto our body earlier would be able to keep us alive for a longer period of time. I mean, the human animal does great at 35 degrees centigrade of a basal body temperature, normal being 37 degrees. In Fahrenheit, that's 98.6, and maybe 35 degrees centigrade is maybe 97 degrees. But when we are working to stay alive because of our high stress response, we get cold, we get moody, we move away from having normal menstrual cycles, our libido goes away, we suffer from dry hair and dry skin. Why? Because we're moving to try to stay alive, and we're willing to jettison these luxuries of having plenty of calories in our diet to stay alive. And this is why a high cortisol state drives us to hypothyroidism. Now, what happens is that cortisol works at a number of places along the pathway between the hypothalamus and the thyroid, reducing TSH, decreasing the amount of stimulus of the thyroid gland to make thyroid hormone. It works at the thyroid gland, actually lowering the amount of thyroid hormone that is made, and it works to suppress the conversion of the inactive T4 into the active T3. And the last thing that high stress does is it promotes more production of reverse T3. Remember, this is the evil twin doppelganger that works against T3 to then fully lower our metabolism. But to really understand thyroid hormone, we need to look at it within a larger picture. And over the course of these videos, I'm explaining through what I refer to as my pyramid health systems, why thyroid health is situated so integrally into this strata in which we need to be managing our energy and thyroid. Now, what I like to refer to as the metabolic energy strata, and it involves 3 hormones, which is cortisol, insulin, and thyroid. Because at the end of the day, to stay alive, to reproduce, to perpetuate our survival of our species, we need to be able to maintain our metabolic energetics, and thyroid, in its ability to send us into a relative state of hibernation, is so important. Now, in this video, we went over 3 important things that your doctor probably has not considered in evaluating your thyroid health. And now you have the tools to understand that you need to measure your thyroid hormone completely to really understand what's going on within this hypothalamic, pituitary, thyroid, and effectively cellular axis. You learned that stress and thyroid are intimately connected with one another. And you also learned that there is a very significant predominance of people out there who are struggling with Hashimoto's thyroiditis but don't know it. Now, if you guys are still with me and you really want to get an idea of where you stand on this disease to wellness spectrum on with a functional perspective, I've done a really cool, simple 5-question, 2-minute self-assessment that you can access by looking into the description of this video below. That's going to help you to understand where you stand by doing a little bit of self-exploration, because as you develop the tools to understand what's going on in your body, then you can begin to take the steps to feel better. As always, I'm making these videos for you, and I will see you all in another video. And take care.